We have a few little things to address before getting into the walkthrough. But first, thank you very much for your time today attending our masterclass part 2 about digital pathway to streamline Peri-op patient journeys. My name is Guillaume Leroux. I am a registered nurse and customer success manager at Personify Care, and I'll be your host today. I was also host for part 1, and today we'll build upon what's been starting to be built last time in part 1 about a Peri-op journey. So I would encourage you to, if you find this interesting, but you're missing a few parts, watch the part 1. It's going to give you a lot of understanding what we've built so far and the continuation of this run through. Before I go further, I'd like to do an acknowledgement of country. I'd like to acknowledge the Ghana people, traditional custodian of the land on which I gather today, and pay my respect to the elders past and present. In the spirit of reconciliation, Personify Care acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay respect to the elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islanders peoples today. Today's topic again is digital patient pathway for beginners. So what we'll cover today in a little bit of a busy masterclass that I'll really show you what we can do with our pathway editor and our platform to deliver intelligent and responsive patients digital experience. This refers mainly as started last part as kind of a case study. So today we'll build upon this case study and try to address the little bit more customer requests that are, might be coming, that are taking from example already from our customers. Say, these are the things I'd like to solve for my specific area. How can we implement a pathway that addresses, some of those KPIs, some of those performance metrics and patient-centered experience that we'd like to embed in this digital patient pathway. So briefly, meetings, demands of increased patient volumes and complexity. Pretty sure this is something that every surgical health service is facing. Reducing cancellation and confusion. This is something that is, if it's an issue, can be addressed, slightly addressed via Personify Care. Optimized discharge planning. So last time we built a pre-admission only pathway. Today we'll try to prepare the patients and the clinician a little bit better for also the discharge planning of this patient. And try to, on this, try to reduce wait times. If we have a busy, health service that's struggling to manage a high volume of patients, and, improving the capacity as well of the clinician in that service. Sounds very beautiful. Let's delve into the practical side of things. So before we go a little bit further, I think that would be relevant to reflect and remind what we consider Personify Care a digital patient pathway. So a DPP for short, right, is let me just bring my thing here. Say a digital patient pathway, they're digital patient journeys designed by clinicians for the needs of their patients and their context and their workflow. So our digital patient pathway solution allow delivering, to patient personalized information, such as could be documents, surveys. We're now delivering consent forms, payment services, notification, to name a few, and all those to improve this patient-clinician interaction out of the point of care. This pathway also designed to fit existing workflows and deliver efficiency for the clinicians and the admin team or medical teams, as well, any team that are embedded in the pathway, by allowing those different teams to review the patient's answers and interaction by exception. So that means that, for example, instead of reviewing 100% of your patients' pre-admission surveys, or having to call 100% of your patients before they coming to an admission, like is often the case, teams can now focus on the 20% of patients actually required require further attention. And ignore the 80% that may say, yeah, I'm attending, there's no issue with that. So in the masterclass part 1, just to recap, let's go into our digital pathway solution to have a look at what we built last time. So what we're looking at here is our platform, what we call the pathway editor. We've created all those activities during the part 1 of our masterclass. And so if you want to have a look at there, how to embed a picture, how to embed different messaging, and how to schedule activities at different parts of the patient journey, we develop upon that. But to recap, last time we've actually embedded here a welcome message and 3 very specific surveys that are usually facing an administrative team. So we have one patient detail survey that includes demographics. We have a confirming your attendance whenever a patient is giving an admission date and time in this case, which could be months before it actually comes in. And we also develop a COVID-19 screening survey that is being given to the patient with a notification at 2 days before the admission time and admission date of this patient. So that means here we also have other activities here that are distributed to this patient just before admission day, at 2 days before admission days. That includes, in this case, an endoscopic consumer information document and video. And a reminder that the patient is coming to, at this time and this date, and they have basic fasting instruction with maybe a Google map hyperlink and a picture of a map to get them to come at the correct place. Now, let's build on this pathway a little bit more with another requirement for this customer to meet demand of increased patient volume complexity, right? How do we do this? So we'd like to do what's called a traceable, digital pre-admission assessment, automates timely delivery of patient education, alleviate some of the workload for the different teams in there. So that means maybe also nursing team and admin team, and meet some specific requirements regarding wait times by increasing the effectiveness, of screening for patient risks. So to achieve those results, we'll demonstrate some of our features, such as utility of tagging information and reviewing patients by exception, by setting up a few different alerts for a pathway, including flags, tags, and BMI calculation, for example. All right, so let's go back to our platform and start doing things. So first, let's look at the patient detail form and set up a few tags. So as I said before, the patient detail form in this specific workflow is addressed by administrative team. Now, what we know is that those in this workflow, the admin team will have to review every single patient that has completed those forms. In this situation, we're not yet integrated to EMR. We're at the point where we can implement this digital pathway in a few weeks, deliver high efficiency for team very quickly. And then along the way, if this actually delivers, efficiency to the team, then it can justify integration to an EMR a little bit later. So in this workflow, right, so as I said, admin team will look at the dashboard, and something I'll do at the end of this masterclass, show you the workflow of a team. But for those admin team reviewing those patients, we want them to actually view quickly if a patient actually needs some specific interaction and action from those team members, such as in the situation we're talking about a small private surgical hospital. It might be a need if the patient is covered under Department of Veterans Affairs, for example. They need to sort out the insurance coverage. So the first thing we want to do in this situation is that we want the admin team to know that this form is completed, for them to say, all right, now it's the time to review this patient. So I'm going to go and do editing activity and set up a flag to say that the team can review when it's completed. And this is very easily via the alert tab that we have on this activity. I want to tell the system to say, all right, if this activity is completed, let's simply raise a flag. And from this flag, I'll select one of the color and say that green flag will be dedicated to the admin team. So it's easy for them to find. And let's give this flag a title, such as if it's green, completed. All right. click save. Very simple. Now we have a form with a flag that will be raised when it's been completed. The next part here is that we also want to raise a tag, and I'll show you what the tag is at the end of this masterclass. But this is also to be able to attend by exception. So in this situation, let's have a look at one of those patient answers. In this case, the Department of Veteran Affairs question. So we might have this here a little bit later. I think it's question 26. That's right. So I want to tell the system that if the patient actually answers yes to this specific question, I want to trigger an alert as well. And in here, you can see that I've got this little alert that pops out when I hover my mouse over the yes answer. And now you can see I can say, well, let's trigger a flag. But in this case, I'll select the tag icon. And you can see here, this triggers my alert automatically. And now in this situation, I want something that says DVA when the patient actually answers yes to this specific question. And let's click save here. So now, very simple, right? If I can set up other alerts with any of those very specific patient answer. In this case, for example, I've just set up 2 different alerts, but especially we have a tag called DVA if the patient needs some attention from the admin team, and a green flag is raised in this situation. Now, let's quickly right now see what it means in terms of workflow, right? So if I'm part of the admin team, I'll go into the home tab that we have here. That means I'm having a look at the dashboard, all the patients that I've created an account in Personal Care. So this is mock data. We have mock patient here, so no real data transferred. But what you can see, if a few of those patients have raised some flags. Now we've got 5 patients here, but if we have a dashboard with thousands of patients, it's as simple as looking at the green flag tag that we have on the side here to say, here are all my patients that have completed this form. And now let's have a look at a little bit more details in their patient account. I can see right at the top that we have DVA tag that has been raised, maybe as well that is not insured, and in this case already a BMI that's being calculated. I'll show in a second how to set up the BMI, but in this workflow right now, I know which patient has completed. I can go to completed activity, means all the surveys completed by this patient, and I can have a look at patient admission form right away and see clearly what alerts have been triggered by this form. As an admin team as well, part of this workflow would be that now, once it's addressed, I can simply clear the green flag from this area, all right? Put a note in here to say that this has been addressed. And now I've got one less patient in my checklist to actually address today. And that's been printed already from this side. Let's have a look now at our second customer requirement. If there's any question, please send them into the chat. I know I might go a little bit quickly as well. Emma reminds me that we had a poll as well to deliver at the beginning of this session. Let's send it now, Emma. I think this takes just a few minutes. We can have a look at the answers a little bit later, but that's going to be interesting to see as well. What are the issues that you are facing, and when do you think that this should be addressed? All right, so here's the poll. I'll wait just a few seconds for you to just answer those questions, and I'll continue on the second part of this masterclass. We can have a look at the answer in a minute to take a little break. So second requirements from this specific customer is meeting the demand of increased patient volumes, right? How do we try to address this in terms of efficiency with a system such as Personal Care? So some of the things might be, right, conduct traceable digital admission assessment, alleviate the workload for multiple teams. Sorry, this is the thing I've addressed already. The next part, this is the one, reduce cancellation and confusion. So in this part, what we're going to address is mainly how can we really deliver a lot of value is try to increase the patient engagement to those digital systems, right? So to be able to reduce the load from a clinician perspective, we want patients to be able to complete as many activities, useful activities in their digital accounts. So we'll look at a little bit what is digital engagement and how we can trigger things into our system for that. As well, right? We want to ensure patient clinician have the information they need prior to admission. And we want to provide a patient with consistent pre-admission information that's relevant to their procedure and their recovery. So having something that is mainly patient-centered, focused, right? That is individualized, so there's no confusion, things are delivered in a timely manner, and things are relevant to their care. All right, let's go back to our Persify Care platform and look at how to increase the engagement side from a patient perspective, and as well from a clinical perspective. So if you're a little bit like me, right, I might have, received a text message, whatever, I'm at work or I'm at the shop doing something else, and I look at this, I'm like, oh, I don't have the time to go in there and complete the form at this point. I'll probably try to remember it and do it maybe in half an hour later. And then the days goes on and I totally forget about this. We got plenty of other things to do in our life. Unless I'm reminded to come back to complete this form, I might never actually engage with the platform. So our system is actually designed to trigger interaction as well with the patient if something that's important for the clinical side is not completing from a patient perspective. So let's set up a reminder, for example, if this very specific patient detail activity is not completed from the patient after a specific date. So to do this, I'm going to select this activity again and go back into an edited activity mode. And you can see here, this is very simply set for customer to be able to set this themselves. Go back in the alerts and set a new alert for this activity. So now if this activity is actually not completed in this case, so that means this activity schedule at a very specific time. In this case, you can see here that it is scheduled at registration. But we could set up this activity if it's for the COVID screening that is set up admission minus 2 days. Say that if this activity is not completed after a few hours or few days, I want to remind the patient to complete this because it is quite important. So if this is not completed in this case, I'll probably set up a rule that's if it's not completed after 2 days after scheduling, then let's set up a messaging to the patients to remind them to come back to their account. So I'm going to put in there a little subject. So depending on the patient preference, whether it be email or text message, the subject here will come out mainly for email notification. And then in the message, this is what's going to be included in this email or text message. I'm going to copy paste from the cheat list here. Well, let's have a look a little bit more what this is about. We got a small message, hi, first name. So first name is what we call a smart tag, and is actually a smart tag that we can pick from a list that we have at the bottom here. And it's something that we can customize for our customers' needs. At this moment, right, it's going to simply pick the first name from the patient account to personalize this message when they receive it. Please log back to your account, right, via link. And in here, right, because it's a text message or an email, we want to include there a URL for the patient to click and come back to their accounts in which they've already created a password, so they can, log in to their secure accounts and look and consult this confidential information in their account. And in here, right, I've included as well a signature, and this is an important part of patient engagement, create kind of a behavior that the patient knows where it's coming from, who they're talking to, and that they is actually clinician and people on the other side of this message that is waiting for their interaction. All right, and then I'll create a small title for this rule here at the top, patient notification. Now, the next part as well is that I don't want to forget that there is also a clinician on the other side that is waiting for patient to complete something. Now, because, healthcare is complex, but we don't want surprises. As a clinician, if you have someone that's registered to a system like this, we want to know if the patient actually is not engaging, because this patient, for X and Y reason, might have some difficulties, lost their cell phone, or eventually said that, yeah, actually, I've got difficulty with my, with my eyes, I can't really see on this platform. They might require to do this in another way. So we have, a small percentage of patients that need a little bit more follow-up, but we need also the system to tell the clinician that those patients are waiting for an interaction from the clinical side. So in most situations, what I'll also do is create another alert that said that if this activity is not completed after, let's say 4 days, then I'm going to raise a specific flag. And now we can choose the flag depending on workflow. In this situation, I'll raise a yellow flag that says that all activities that need to be followed up by, staff will have a yellow flag, so that those yellow flag prompt clinician or an admin team to pick up the phone and encourage the patient or address the patient via other ways that is more suitable for their needs. And let's not forget as well to just put a little title in here, so this alert is triggered. So I have a question here. Can I have the recorded session to share with my colleagues? Yes, indeed. This will be sent by email directly to your email in the next few days. With this recording as well, recording of the masterclass one for your for ease of care there. All right. So now we've set those a few alerts. So let's just recap there. Patient has not done anything after 2 days. We're sending them a reminder to come back to their account. We can set as many as the customer wants for those reminders. Then also, if the patient is not engaged, we're raising a flag so that a clinician can take another action, maybe picking the phone or even sending them a notification directly via the system with their signature to say, hi, can I help you out? Or do you require some help? Or give us a call back so we can address your specific needs. Let's save those change here. That's it. And we have those new alerts set up with this specific survey. All right, at a survey. The last part here as well regarding that specific workflow is we want the patient to engage to maybe tell the admin team before the admission date that they're actually going to attend that admission date, right? We might have told the patient already via this pathway, via this activity here, confirm your attendance. This might have been given it months before the admission date, but we know that a portion of patients actually, are scheduled for admission, but are not attending for personal reasons. And now some customers are starting doing this, and is saving a lot of time from an administrative point of view, but also allows a better booking of operation room is by actually sending a small survey to the patient. So let's say 2 days before the admission, that the patient will answer in there and say, yes, I confirm that I am attending to that or are booking in 2 days' time. Some patient might actually say no or not engage with the system. And those small amount of patients then might require a phone call to make sure that they're attending or be able to rebook this or availability to another patients that could come in their place. So this is very simple, right? I've created a new activity here, which is going to be a 1-question survey. And this question survey, let's give it a title, says confirming your attendance. I'm going to make this activity as an assessment. And we have here, I've already built a list of library of surveys, which is, always designed based on what a customer is giving us by paper or already doing by phone calls. We're digitizing those questions. Here, let's put a confirming your attendance survey. And I'm going to schedule this at 2 days before the admission date to go in the same interaction points that we have designed in our part A of this masterclass. Let's click save. And now we have this confirming your attendance survey that will be included in their checklist that we already here are telling them the admission date and time, instruction that here you can edit yourself and design this, some instruction regarding fasting again, and say the patient can answer, yes, I can attend, or no, I cannot attend. Let's not forget as well to set up a little flag if the patient says, no, I cannot attend. This might be, looked by nursing team. So I'm going to set a red flag in this situation if the patient says no. And that's simple. I've created a small workflow to address all the phone calls given to patient 2 days or 1 day before admission to be able to now, know which patient needs to be called. And usually it's about 20 or less % of the 100% of patient that needs to be addressed. And maybe even rebooking some OR room. If a patient says, no, I cannot attend, we still have maybe 48 hours or 24 hours to actually book those OR room at its precious time. All right, let's take a small break before going to the next section. Emma, can you bring the poll answers and have a little bit a look at those answers from our audience? So first question, visibility of patient. When do you think we'll solve interoperability in Australia? There was one of those questions, those things that I've addressed at the beginning about EMR and this situation. We're not integrated yet to an EMR. And I can see that most of the attendants here don't think that's going to be addressed. I mean, as nationwide across all health services is going to be a very complex operation. I think to me, what's relevant in this situation here is that we've designed a platform to integrate with EMR in general, and we don't want to be a silo of information. At the moment, you see that in the workflow, most of our customers will extract the data in the form of a PDF or something like this. But in general, what is really relevant is that we can implement digital pathway very, very quickly in a few weeks' times. And if we bring value, then this gives, arguments to your IT team and your executive team to say, yeah, all right, now you already have value with these systems. Let's put a little bit more money and time to deliver even more value with integration to the EMR. And next question was, what's the main communication issue between clinician and patient you'd like to solve? So it looks like most of people here is about reliance on paper form. Consent is also a big part of this. I think consent is definitely something that we have a very high demand for. There is very often question about what is consent, in terms of product or feature for our solution. We're not here to replace the face-to-face interaction in that precious relation between clinician, doctors, and their patient about consent. We're here to help out with the paper version of saying, yes, I have time to reflect on that, on those risks and what it implies to go to surgery or have a treatment. Maybe even now we're starting to allow the delivery of video interaction that give more information about consenting. And when the patient is happy to consent, they can digitally sign within Personalized Care. We're delivering this for health services, but also research areas for different universities across Australia at the moment. And yes, don't hesitate to put more questions in the chat room if you have any of those. All right, let's delve into kind of the last part of our digital patient pathway solution, which is let's try to reduce wait time and improve utilization of hospital capacity. So, sorry, I think I jumped slides. We just did reduce cancellation. Now we're going to look at optimizing the pre-admission and the discharge planning of this patient pathway. How to do this is that first we'll try to implement as well a health history form that's specific to nursing. That's something kind of a pre-admission screening that most surgical areas will do within Personalized Care. Within this form, we'll set up very specific type of alerts that might help the nursing team save some time to be able to triage patient by exception. And the last thing we're going to do here as well is a little bit more complex is actually try to trigger very specific patient-centered consumer information that's relating to this patient that says, yes, they have diabetes type 1, and we have a specific documentation relating to a colonoscopy for those patients. Then instead of having to review all patients that are going to colonoscopy if they have type 1 to then deliver a consumer information, the system can actually detect those variables automatically and deliver this consumer information at the moment the patient answer and fit those criteria. All right, let's delve into our run through. First thing that we want to do in here is implement a pre-admission nursing screening. So let's create a new activity here regarding the health history form. So I'm going to create a title for the patient here and select from our list of assessments our health history form that's already been pre-prepared in the past. Patient health history here. This is going to be delivered at registration. So I'm going to leave all those scheduling fields empty, and I want every patient to complete this. So let's just click save here. And you can see here that the health history form is now being scheduled in our patient pathway. Now, this is, of course, always designed to the current survey that's been designed by our customer. And at the moment includes weight, height, and other type of questions. Here, I'm just going to reorder it in the list to be a little bit higher. And the next part here, right, simply go into editing mode and say same thing, like I'm going to set up a red flag for the first question if the patient says yes to elevated cholesterol and triglyceride. So clicking on the red flag, and this is something we get our customer to do themselves, setting all their alerts in their health history forms, for example. The next part here is that I also want actually to trigger very specific, a little bit more complex alerts to deliver more efficiency, right? In this situation, right, we know that most patients answering weight and height will have a BMI calculated at one point or another to determine if they are at risk for obesity and, maybe at risk for extubation for anesthesia risks. Something that is very, very common. Now, thanks to technology and mathematics, right, we have actually embedded in our system a way to calculate BMI easily. So let's just set up this quick alert to say, I want to calculate a BMI, but not only calculate a BMI, I actually want to trigger an alert if the BMI calculation is over a certain limit that fits my clinical governance threshold of, in this situation, let's determine that at about 40 of a BMI. So quickly, now this is how we create the alert. I think what's probably more interesting to audience here is that what we're trying to achieve with this specific clinical alert. I'm going to create this, what we call an expression to say, I want to tell the system to calculate a BMI. And this is what we have as a formula here. And let's trigger an interaction in a system if the BMI is over a level of 40. So if this patient fits this criteria, then I will want to raise a flag in a situation. And it's going to be a red flag because this is going to be addressed by the nursing team. Of course, I'm going to give this a little title in terms of auditing. So I know after later as well what's been triggered by the system with this alert. All right, and click save. This is it. We've created a very specific alert relating to a BMI calculation. With the same principle here, I think most customer will want to see the BMI number of this patient calculated as a tag, as we've seen a little bit earlier for the patient detail account. We can show the BMI for every patient, but we can also say, on top of this, if it's over 40, raise the flag. Now, the last part, now that we understand that we can actually trigger, tell the system to find very specific criteria and trigger alerts regarding those criteria. Let's delve into something that's really relating to patient-centered activity here, that if this patient says that they have diabetes type 1 and they are coming for an endoscopy procedure, then I want the system to trigger a very specific PDF that we already have in this pathway. And let's have a look at this PDF. This is a PDF I found, by Googling type 1 diabetes before surgery. So this was available on the net. We have this PDF here. And if I go just show you how to set that up, that's the URL that's actually I've uploaded a PDF to our cloud server and just put the address of this PDF to distribute it. And the patient will have access to it within Perspective Care right away. So now that we have this PDF available, let's set the alerts to trigger this PDF in this very particular case. Let's go back to the health history form, because this is where the patient will answer that they have diabetes type 1. So this is an existing question in here that we have type, question 11. In this situation, we're asking them if they have diabetes. And then after that, if they say yes, then they say type 1 or type 2. Now we can, determine that in the system, all right, the patient says type 1 in this situation. So I'm going to trigger another very specific alert that will detect those criteria. So again, creating this very specific alert in here. And I'm just going to copy paste from what I've created in the past in here. And to have a look at what this means in terms of system workflow. Now I'm telling the system if this patient has answered to the question of diabetes, that they have type 1. And in the procedure variable, they have this variable that we call GI1. In this situation, it could be endoscopy, and this is something I've shown in the masterclass part 1, but when we invite a patient, we can select the procedure type that they will be invited to. In this situation, we say the procedure type for this patient that fits this criteria is GI1. Then I want the system to actually create an activity that we already have in bank. And in this situation, I want to create the diabetes management for colonoscopy activity. All right. So, and last thing, I'm just going to give it a title as well for the alert. Right, and click save. So here we have a condition says to the system if the patient fits those criteria as type 1 diabetes, and this procedure is GI1. After the patient has answered this survey, please trigger this activity, which is diabetes management for colonoscopy. Now, the patient, after they submitted the survey, is still likely in their account completed other activities, and they will see this new consumer document popping out as they fit those criteria. Now, if there's something as well that happens, the patient have left their accounts, so they haven't seen this new activity popping out before we have actually triggered it. We can also put reminders, maybe 1 day after it's been triggered, to remind the patient that they have this activity to complete in their accounts. So we increase engagement and we ensure that the patient is prepared and reading those documents at appropriate time. Now, I'm conscious that's a lot of information in one go. I think especially the practical sides, but I think at the end, I want to give the message that we can actually design patient-centered activities that allows as well clinician to be relieved of having to trigger and look at all the patients and select all those patients that actually needs those specific forms to be given. And sometimes it's something that they need to do face-to-face over the phone, send this information by mail. Now it can be automatically triggered into those digital patient pathways. Now, the last part that I wanted to overview as well, and is very quickly, is that we said that we design a very short survey for a post-discharge interaction with this patient, right? So in this private small hospital, they have a high number of day stay. At the moment, most of the workflow happens that the patient actually being called on the phone 1 day after discharge to see how they're doing. And I know by experience that the rate of answer is quite low and is usually about less than 50% of patients that would answer those phone calls are being reached. And there's some protocol about having to call the patient 2-3 times and then stopping to call after 3 times. It's because it's too costly in terms of workforce. Now, the patient actually has already engaged with experience like this. We see that a very, very high response to very short survey after discharge in those situations. So let's create this follow-up information for patient fitting the day stay criteria. So creating a new activity here titled Discharge Planning. I'm going to pick from my assessment list again. And in this situation, I'm going to pick my discharge planning survey here. The schedule is going to go to the patient, let's say, usually 1 day after the admission date. And you can see that all those little criteria here, for example, the different dates, they're all customizable depending on our customer requirements. So I'm going to select this after admission dates, and I'm going to leave the time here empty because the system is actually going to pick the best suitable time for this patient to answer this survey. We're also going to create a notification for this patient to be able to come back to their accounts. Say, please log back into your accounts. via a link to sites, all right? And we want to create something as well that's very similar from the other messages to create that behavior to come back, and click save. There we go. We got now there's only one question, but you can add as many questions as you want to this survey to send to the patient to follow up after discharge. And it could also be a survey that's repeated over time. If you have 3 surveys once every week for complex cases, then we can design as well those surveys in there and create alerts within those surveys to be followed up by post-discharge staff, nursing staff, or other areas that are attending those specific workflows. All right, let's come back to our slides and recap slightly the things that we've seen today. I think that we've talked about a lot of different things that we can help in terms of adding to the things we've created at the beginning. So, right, reducing wait times, improving utilization for hospital capacity. We're doing that by trying to engage the patient to a digital experience that will be responsive to their needs, and as well be able to increase their completion rates to surveys that are required from the clinical side, as well delivering those interaction and be able to screen risk and be able to review your patient by exception, both for admin team, nursing team, and now also helping out medical teams by setting up alerts. It could be as simple as a BMI. And we're starting to help out as well a much more complex alerts, such as evidence-based anesthesia alerts based on frailty, multiple questions, calculation together, sleep apnea questions that require the patient to answer 4 or 5 different questions before being able to trigger an alert or a score. Those are things that can be automatically delivered via a pathway such as this one. And as well, trying to get the patient to tell the clinician and the admin team that yes, they're attending some specific dates, or no, they cannot attend. They want this to be rescheduled, or be able as well to rebook all our rooms on an appropriate time. And then you can see that you can start very basically with a pre-admission pathway, go live with your patients, and then build upon this as you see that it's fit. You say like, now we want to add post-op follow-ups. And we want to actually now we've designed a new documents that actually need to be sent just in those cases. You can embed this even after going live with patients with those digital pathways, with giving our customer the tools to be able to set some alerts. And of course, our expertise as customer success manager allows well to allow a customer to add more value things that they didn't know they could do. And by set up more complex mathematical, triaging settings in there. All right, before going to the last slides, this mainly concludes our masterclass run through part 2. Please open up your mic, give me some questions or feedback that you have. I'm pretty sure you must have a few interrogation about the things you've run today or other capabilities that we might have. I'll keep silent for a few minutes. Yes. There's a message from Emma in there that's we're attending Queensland Healthcare Week. And you can come and visit us if you're on site. That would be highly appreciated. You can ask Michelle and Ken from our sales team if you have any specific questions regarding our platform. No. Michelle is just there. So now, don't hesitate to open up your mic and ask some questions. I wanted to finish maybe just on this little graph that I've actually found. Somebody shared this on LinkedIn this week. I had to do a little bit of research to find where it was coming from, but this is actually a graph that's been designed by Deloitte in Europe about the different objective in a value-based healthcare journey. And I found it very useful because I know that's in Australia. Most of you must know that slowly there's a big trend going towards a value-based healthcare by gathering more patient outcome and experience measured in order to be able to improve health services, but also probably change or maybe transition towards a different type of funding. And I found that digital patient and technologies such as ours address some of those different objectives in there, such as improving clinical outcomes and increasing economic efficiency and augmented patient experience. Rebecca, I'm sorry, miss anything. I just confirm that the consumer staff reports their comorbidities. This will obviously double be checked by booking officers to confirm the consumer staff reports their comorbidities. Yeah, that's correct. So what we usually do is actually we take your surveys and digitize them, right? So those are the surveys that usually the patient fills out by hand, and then they can now fill them out by digital version. And of course, all of those surveys, as well as the patient identity, is checked via the system, so that nurses can see what's in there, and if there's an issue, address it with the patient directly, or as well, the goal here is to be able to screen the patient by exception instead of having to screen 100% of your patients. I'd love to see some screen capture video of what a patient would see and do on their device, which really show the benefit and help our clinical leads. Yes, that's a very good point. So actually, what you see here on those slides are actually screen capture of this exact pathway that we've just built, right? So in general, this first screenshot we see here is the checklist that the patient sees once they enter their patient account. You can see in here, there are 4 different activities to complete. The patient will click on the click to complete button. And then here is the address question from the patient demographic questionnaire. In this situation, right, very simple, we're plugging with a Google API and the patient starts entering their address and it pre-fills it automatically and also orders the data in a way that's exploitable much better in terms of informatics. In here, there's an example of a PDF. Right, the patient can actually look right at it from their activity. And here, another question as well. Here is the survey when the patient actually confirms if they're attending their attendance, which is very useful because we can actually, bolden and put emphasis on what's important for the patient to note right here. All right, I hope that's addressed some of your question, Steve. I think we might have also other example on the website of the patient experience. And that's also something I believe that you can try yourself via our website to invite yourself and try a patient experience. If you want as well, if you want to, you're happy to share your mobile number in the chat or directly to me, I can invite you to the patient experience we have just created right now. And you could be doing this patient experience in the next 10 minutes. If that's something that's you have the time or you're interested in doing. So don't hesitate to share your mobile number via me directly and invite you to that very specific patient experience with design to give it a try and see this on your mobile. All right, that concludes our masterclass. Yes, exact. So please share your mobile now if you want. And I hope you enjoy this session. We'll send the recording. We're also probably going to attend a 3rd part masterclass for digital patient pathways. And if you have any comments or feedback you'd like to send as well, send this at contact@personficare.com. And you can also reach us via chat platform on our website at personficare.com at any time. Thank you, Steve. I will send you an invite in the next few minutes. Thank you, everyone. Have a good day.